Hello, everyone. We're joined by Ted Alcorn today. He's a writer and an independent journalist who did a great deal of work on this project. We also have Dr. Camilla Venner. She's an associate professor of clinical psychology at the University of New Mexico. Dr. Jenny Way, an internal medicine physician at Gallup Indian Medical Center, and State Representative Joanne Ferrari for Doña Ana County. Thank you all for joining us for this important discussion. We want to follow this very closely here at New Mexico PBS, and we thank you for your time today. Ted, let me start with you, of course. You wrote each article in a 7-part series, in case folks haven't not seen this yet, on alcohol use and misuse here in New Mexico. Can you start by explaining how this project came about, and why did you think this issue deserved this kind of coverage?
Well, about a year ago, New Mexico INDEP asked me to look into a story on alcohol. They had some suspicions that the mortality we were seeing for COVID was connected to alcohol use in the state. Mm-hmm. But it didn't take long for me to notice some of the basic factors that make alcohol really stand out. New Mexico has not only the highest rate of alcohol-related deaths in the country, we have the highest rate head and shoulders over every other state. And the more I learned, the more I felt like this sort of catastrophe that was happening in plain sight was the result of a lot of misconceptions that we have about how alcohol affects our population, what we can do about it. Mm-hmm. And so as the reporting went on, I spoke to more and more people and collected data. It felt like it needed a lot of space to grow. So in the end, as you said, it became a 7-part series, and I interviewed over 150 people for it. And, I think we came to some conclusions that surprised even me.
Mm-hmm. One of those conclusions, by the way, in the first in the series is brilliantly titled An Emergency Hiding in Plain Sight. Very apt title there. Kind of sets the stage with this issue we're facing in New Mexico. Let me ask you this. Through your research, you found drinking kills New Mexicans at a much higher rate than anywhere else in the country. The conclusion reached is that we failed to address this crisis in part because we've misunderstood it. What's been the big misunderstanding in your research?
Well, there's been a few misunderstandings. Mm-hmm. I think the first one, growing up in Albuquerque in the 1990s, was that I was, both aware of the tremendous problem of DWI in our state, but also buffeted by the policy prescriptions that we were starting to put in place, because at that point, our state really made a collective and systematic and sustained effort to reduce DWI. And I think that has had numerous benefits. We brought down the rates of crash fatalities a lot, mm-hmm. but we kind of missed the forest for the trees, because when you look at alcohol-related deaths nowadays, DWIs only account for about 1 in 10 of them. So 9 in 10 of alcohol-related deaths in the state are occurring elsewhere. We overlook the role that alcohol plays in violence. As it turns out, we have, of course, widespread shared concerns about having a safer state. Our elected officials are talking about it. What they don't often say is that 40% of people who died by homicide in the state died with alcohol in their blood, as did 30% of people who died by suicide. So alcohol is the most common intoxicant in violence in New Mexico. Those are the kind of blind spots, I think, that have kept us from addressing this issue head on.
Good points there. I want to bring in Dr. Jenny Way on this issue. Doctor, how should we approach this clearly life-threatening, issue, and what do we need to do to get a better understanding as New Mexicans about the depth of the problem?
I think the main important thing is that alcohol use disorders, people who struggle with alcohol use disorders, it's a multifactorial cause, and I think because of that, there are a lot of differing preferences as to how people want to be treated. Mm-hmm. Differing main underlying causes result in different types of treatment options. So, for example, I think a lot of people struggle with I work at the Gallup Indian Medical Center, who serves primarily Native Americans who suffer from depression, anxiety, PTSD. A lot of people who struggle with alcohol use disorders also have comorbid mental health disorders, and it's important to treat all of those. Right. And it's important to treat, I think what we say a lot in addiction medicine is that every door is the right door, whether it's through my primary care clinic, whether it's through when they get admitted to the hospital in the intensive care unit after a motor vehicle accident or broken bones, or whether it's through the emergency department. We need to make sure that in every possible door that people are entering, that there are treatment options available, that we offer them in the emergency department when they're admitted to the hospital here and when I see them in the primary care setting. I think too often as primary care doctors, we feel we treat the the complications of alcohol use disorders, like liver disease, like the broken bone that happened or the motor vehicle accident injuries. But we don't really treat the underlying cause of all of these problems in the first place, which of course is their alcohol use disorder. And given the extent of the problem, we cannot just put that on behavioral health specialists, psychiatrists. We as primary care providers need to be taking ownership of this as well, given how severely under-resourced our behavioral health departments are in the state. And so I very much believe that as a general internal medicine provider, family medicine provider, general surgeons, orthopedic surgeons, all of us need to be able to treat alcohol use disorders and not just rely on the non-existent behavioral health department that may not be able to get an appointment for many, many months.
If I may, I just wanted to put that in context too, because the state has looked at the scale of untreated substance use in the state. And we talk, of course, a lot about the state's struggles with opiates, fentanyl, methamphetamines, but alcohol is the biggest untreated substance use problem in New Mexico. There are 73,000 people who are estimated to have an alcohol disorder who aren't getting treated. And that's more than people with disorders for all other substances combined. So it shows that there's a big opportunity for the care that Dr. Way is mentioning.
I'm glad you got that in. That's an important point. Dr. Venner, interestingly, when I reading the series, it really struck me how screening by docs could be so impactful here. Why is this not really kind of taking root just a little bit with a little bit more vigor inside medical circles? I'm curious your opinion on that.
Well, I'm not a medical doctor. I'm a clinical psychologist, but what my understanding, doctors have a lot to do in their 12 minutes or 15 minutes that they have with patients. So it can be, an issue of time. There's also an issue of training. Not a lot of training in medical school and residencies focus on addiction. For as much as it shows up in clinics, they don't get that much training. So I think there can be a self-efficacy piece where they're not really entirely sure what to do if the patient does screen positive. In a slight brief intervention in a compassionate way, to talk about, what are they thinking? Here's what we're seeing. What do you think about that? And having a nice conversation and having an open door, like Jenny Way says, every door is right. So I think there's a lot more we can do for training medical students and helping doctors feel, more self-efficacy like Dr. Way feels. So I think there's a lot we can do to help that situation.
Representative,
just on that point,
please, absolutely.
I'd just like to add that, back in the 90s when we passed the major legislation to, combat DWI, we did consider the behavioral health problems of it too, but didn't really reach as far as we wanted to. But something that came out from them was to somehow incentivize doctors by every time that they do the SAMHSA screening, and make it so that we can incentivize them to go ahead and do that and help their patients.
Interesting. Representative, let me stay with you on this. I mean, obviously we had the awful news with the parade in Gallup with the injuries suffered by somebody who appeared to be impaired behind the wheel, and just an awful situation when the law enforcement approached the vehicle, it just took off. Does it make it harder when we have situations like that, or does it actually help move things along in a certain way? How do you see that as an elected representative?
Well, I know that Ted has been working on this series for a long time, since probably the beginning of the year at least. And like in the 90s, when we were starting to look at the overall package of, DWI changes that we needed, the Cravens crash tragedy happened. And just as we were getting ready to go to the legislature, Nadine Milford and her husband Bob became advocates for the change that we needed. So I hope it brings the attention that we need to motivate what we should start, like the governor immediately setting up a task force with legislators and all of the experts such as Dr. Way and Ms. Bummer, and we need to make sure that we use scientific, evidence-based approaches again to revitalize the not just DWI, the enforcement and helping the victims and preventing the consequences, but overall for alcohol-related deaths. And this is really important because I think, as Ted pointed out, that adverse childhood experiences are usually related to someone in the family for domestic violence, for
That's right.
child and neglect and abuse. All of these different things seem to coalesce around the alcohol abuse.